Dr. Alessandra Relini from the University of Vermont is studying the biology of sexual desire. Her scientific protocol doesn't involve X-rays or drawing blood. Instead, she shows her patients dirty movies.
You're going to be watching two videos. One is going to be a video of Russian culture, and then one of explicit sexual pictures. There is a heterosexual couple engaging in sexual behavior. Throughout the entire time of the videos are on, you move this to indicate how sexually aroused you feel. If at any
Alessandra keeps careful track of how sexually aroused her subjects think they are, and compares that data with how their bodies react physically. To do that, she attaches sensors to measure vital signs like heart rate and blood pressure.
And then there is the vaginal photoplethysmograph. This is something that you insert in your vagina on your own.
I've never done anything like this. You know you're doing it for science, so it's all positive. But I don't know.
This is a device that it's one of the most commonly utilized devices to measure blood flow into the genitals. Now, the capillary bed in the vaginal walls become engorged with blood during sexual arousal. So we have an indirect measure of blood flow by looking at how much light is being reflected back. So with this, we get to see what your body does. And here, you tell us what your mind does.
Okay. Thank you.
Still, you have your feet up and you're sitting relaxed on your chair.
Yeah, I'm all set.
The first 3 minutes of the video the subject watches is a 1990s promotional film from the Russian Tourist Board. Its erotic content is non-existent.
It's working just fine, and she's down to the baseline.
Then the video switches from Soviet propaganda to pornography. Immediately, the woman's heart rate accelerates, her body temperature rises, and the photoplethysmograph records increased blood flow to her genitals. Her vital signs say she's getting turned on, but her mind is having none of it. In fact, she's actually moving the dial lower. She feels she's getting turned off. It's a pattern Alessandra sees in most of the women she studies.
For some women, what they're telling me, no, this video is really not doing anything for me, it's not sexually arousing, we see actually their bodies responding a great deal. If you now want to follow me in the room.
For male subjects, Alessandra uses a device similar to the plethysmograph to measure the change in blood flow to the penis. And once again tracks the relationship between bodily responses and mental arousal.
This was the heart rate. When you take a man and you show the man an erotic video, and then you ask them how much sexual arousal did you experience during the video, their subjective response of how aroused they were, it's going to be highly correlated with what you see physiologically.
You could definitely tell the difference from watching a video of a countryside and a road rather than pornography.
Men get aroused quickly, and they don't seem to have much of a mental filter when it comes to lust.
One of the important differences between men and women and lust is that for men it's easier to become lustful.
You know, one of the interesting differences between men and women involves erotic plasticity. So there's some interesting research using devices that measure genital blood flow that seems to indicate that men know what turns them on and women often don't. Women, there will often be a schism between, or a split between how their body is responding to something, whether it be a video or images or whatever, or a story, and what she will report consciously. It doesn't mean she's necessarily lying, it's just that her ability to gauge how her body's responding to things isn't always as clear as it is for most males.